So, guys, tonight I'm absolutely delighted to welcome onto the Chronic Pain Club talk show somebody who I know has got a lot of attention from people wondering when this interview is going to happen. So, I'm absolutely delighted to welcome onto the show Melissa Chieza, who is an occupational therapist, a mental health practitioner who's been living with type 1 diabetes and lupus since she was a child. Melissa, thank you so much for joining me on the show tonight. How are you?
Hi, Joel. Hi, everyone. I'm excited to be here tonight. Obviously, if you hear any screaming, that is my Dexcom G6. But looking at my graph, my blood sugars are stable. So we should hopefully not have any screams for the next hour.
Not a problem.
For tonight.
No, that takes priority, obviously, it goes without saying. But yeah, thank you so much for joining us, and I hope you're doing well, because I know obviously we've rescheduled this one a couple of times because of myself and also things going on your side, but I take it you're well enough to do this and in a good place. Yeah,
brilliant. I had no voice last time, so I don't know how that would happen. It would have been signing off on some sort.
Yeah, that would have been a challenge. We've had many challenges on this show over the years, but I think that the guest not being able to communicate would have been a challenge. So thank you, and and like I say, thank you for freeing up your Sunday evening to join us. So for anyone that's not aware who you are and that sort of thing, we won't deep dive into the conditions and that now. We'll pick that up in a second, but maybe just tell us a little bit about who you are, where you're from, and what you do.
So my name is Melissa Chieza. I'm an occupational therapist by background, and I live in the east of England. But I'm currently working as a mental health practitioner, which is a new role as part of the long-term NHS plan. I've had diabetes and lupus since my 9th birthday, which was a fun birthday, but still surviving and still here today.
And still smiling. Thank you for the introduction. And I feel like before we get into your sort of diagnosis journey and managing that with especially with like the lupus side of things, could you maybe, I think probably diabetes is something people are more familiar with, but could you maybe give us a bit of an overview about what lupus is and how that sort of manifests, and then we'll pick up how that affected you.
So for me, lupus is an autoimmune condition. For me, it mainly affects my skin. Other people, it can affect other parts of the body, but for me, my skin seems to be the one that's mostly affected. So for me, I develop a rash, and that's where things just go to pop. But obviously, that's me. Obviously, diabetes. I can't produce enough insulin like you can, so obviously, hence I need my insulin pump.
Thank you very much, because I'm aware of it, but I know it's one of those conditions that maybe isn't. It feels like anyway in the autoimmune space, it maybe doesn't always get the spotlight it needs. So hopefully we can help with that tonight. So you said that was around your sort of 9th birthday. So what happened there? How did you know something was first going on?
So for me, it was the case. I would come home from school, and then I would literally just go to sleep and just feel tired, and then ask my family, my mom, dad, and sister to bring me stuff to my room because I didn't want to come down and get things. I was labelled as lazy, and then eventually my parents took me to our local hospital, and then they kind of tested me for things, and then obviously they kind of said, okay, she needs specialist input. So I was kind of transferred to a hospital that's maybe 50 miles from home in the east of England. And they had more like specialist testing because it was a foundation trust, a bit more money, as they say in nowadays now. And they did a bit more testing. So I was tested for cancer, leukemia, HIV, basically most tests you had done. And then one of the consultants I had at the time said I had lupus. So initially I started on plasma exchange. It's where they clean out your red blood cells, and then treatment started. They had the diagnosis of lupus. So for me, just for a bit of context, my dad was a nurse, my mum was working in the NHS, and my sister is a nurse now, but she's changed her role. So they were in the health sector, but obviously this is all a new concept. And then obviously diabetes came because I was taking steroids, so hence steroid-induced diabetes.
Oh, I didn't know that was a thing.
So that was my 9th birthday ruined because my sister bought a chocolate cake, which I couldn't really eat. But obviously now I can eat chocolate cake to my content with insulin, but that's how it started for me.
Okay, and if it's induced by steroids, so like chance then that it could go back, or is it like a one-way trip?
So when there was a period where I came off steroids and then I was fine. Then obviously my blood sugars did stabilize for a few days, and then it didn't go so well. But so obviously it is there for life. So obviously that is my life at the moment.
Wow.
But there is hope. Hopefully we're hoping for a cure. Who knows?
Yeah. No, the reason I ask is because I found out for the first time last year about MS, biologics induced MS, and I had no idea that was a thing. And but there was lots of reassurance given to me about that. Well, if you stop taking biologics, most people go back. So I didn't. Yeah, I wasn't aware. I was completely ignorant to that one. So thank you for sharing. That's definitely something on my reading list. So so these two things then, I'm guessing because you're on the steroids because of the lupus. You must have got sort of a double whammy at sort of quite quick succession.
It was a double whammy, and obviously, being a 9-year-old kid, I think when we got the news for the diabetes, I was quickly like, the diabetes nurse gives you like a teddy bear and says, I want you to practice on the teddy bear. And obviously, being a 9-year-old, you're like, what's happening? And then I think the first thing is you try and think, are you going to be able to mix? Because my parents their philosophy was like, she'll still lead a normal life, but obviously we may need to just be there. So I remember digressing a bit, there was a school trip. So my parents said they'll stay in a hotel that was like close in case the school felt they couldn't handle me, but more in terms of like my diabetes. But again, better awareness of that has changed. But as a family, I think we all pushed through, and obviously they were in the health sector. They kind of did everything as best as they could. And then obviously, even till this day, we still talk about appointments, even though I tend to go by myself.
Yeah, and so like obviously you had that little bit of an added benefit in so many people working in the health sector, but what was that timescale like from when you first noticed those being tired and to when you actually got a label for it?
I think it was maybe like 6 months to a year, maybe less, but obviously I was grateful that this was like in 2009. So obviously the health service is a lot different to what it is now. And obviously the quick thinking of the professionals to say, we can't treat her here. She needs to go somewhere else. I think if my parents were here, they would say, oh, it was good that they spoke out and said, let's take her somewhere else. Because sometimes people just say, oh, we'll just treat her here. But I think for them, that was maybe comforting and reassuring in that aspect.
And good, I suppose, that they were willing to do those things and get you the best sort of possible care as well. So in terms of like, you got the tiredness, and you said in the intro, you said it affected your skin. When did you first have issues with your skin?
So my skin sort of came in as after diagnosis. So obviously I think maybe like 2014. So when initially my skin was majorly, I had the butterfly rash and a few symptoms, but obviously no one really knew that as much. But maybe more like 12, 14, as I was doing my GCSEs, that's where I had my first major flare-up. Obviously stress is something that triggers it as well, lupus and stress. Unlike any autoimmune condition or arthritis condition, stress is a big factor. But I think that was like my skin, and then obviously my arms, and then my legs, obviously rash exposure, then continued from then onwards. So for me, in 2023, unfortunately, I got shingles. So that was like a major flare up, which was a low blow because I just started my new job in primary care. But again, I think looking back now, I've got 2 rheumatologists just based on one I kept after I left uni, and then one is like my local one. And it never surprises me because every time I see him, I've known him for the longest, and I always say to him, like, you kind of know that face when someone's about to tell you, like, we need to do this, and you're like, I don't want to hear that. But then again, it's like he's probably, if I was to explain, he's probably seen me through the good times and the bad times, the times where I've like got very angry and then not shouted but not been polite, and then I come back the few weeks later and then I apologize, and then he kind of says, I know yesterday was not a good day. So you kind of feel that therapeutic rapport. But then sometimes like you think, okay, you just go and you see your consultant and then there's no banter. But looking back at my journey, I think with all my professions, there is that banter, there is that jokes, and you can just be a bit like, I've had a rubbish day this month, like my lupus is rubbish or something. Like you can be honest. You don't have to feel like, oh, I have to just fake it till I make it. You don't feel like that.
Yeah. And you said about like the butterfly rash, and I suppose for anyone who isn't aware of that, like for me, that was my first sort of interaction with lupus, and then that presents on the nose and the cheeks, doesn't it? And it's sort of like symmetrical. Had your earlier interactions with getting lupus, being diagnosed with lupus? Were you sort of like ready for that? So you recognize the skin condition as lupus or not?
The skin condition is something we didn't really know because no one in my family has lupus. And obviously, I came to the UK when I was 2. So I'm originally from Zimbabwe. No one in our family history has lupus. So there's a likelihood it could have been hereditary. It could have been due to me changing environments. Obviously, there is still a lot of research into lupus as to why people in the BAME community do get lupus. Obviously, again,
because that is one of the autoimmune diseases where them numbers are really high, aren't they? I understand.
Yeah, the numbers are very high, Joel. And obviously, it's, as I said, my sister has lupus. But then again, it's like we caught lupus at different times. And also, like, her symptoms are different to mine. She wouldn't mind me saying this. Hers is more joint related, but I'm more skin related.
Right.
But then if you ask us, our treatment plans are totally different. So she will take hydroxychloroquine, prednisolone, and azathioprine, but I'm on like the biologics, the prednisolone, and other drugs. So 2 people from the same family, but on different treatments, and lupus impacting us 10 years apart. Yes, there has been studies in Japanese, more abroad than in the UK. Maybe if there's any researchers listening, maybe a research question for you.
Yeah. And I'd also love to get researchers on. We have had one in the past and it was fascinating. I'd love to, because just again, unpicking that, what we understand and why, and also sometimes how the data we have doesn't also give the full picture. Do you know what I mean? I know like in psoriasis circles, there's a big push at the moment to try and travel to other parts of the world where we have gaps in that data to really understand the impact, So if anyone's listening, double call from Melissa and myself, we'd love to have you on. Because I was interested in that, like, were you prepared for that symptom shift? Do you know what I mean? Because with autoimmune, sometimes you'll get diagnosed because of the pain or how something presents, but maybe you're not educated that the rashes could also be one and the same, So, and in terms of like lupus, is there any tests for it? Is there any sort of like genetic thing they test like they do with ankylosing spondylitis or anything like that to diagnose it?
I don't think there is a genetic test. No one in my family has been tested. So I don't know if there's a genetic test. I think there was a research study that was happening in the USA about genetic testing, but I don't know how far that is. But in the UK, there's no genetic testing. Obviously, in the UK, they do check your CD19 to check how many B cells you're producing as an indicator for lupus. But I don't think yet, maybe in the future, as we were hoping, we were putting our wish list out, as I should say, of things that should happen. Maybe that might change. Maybe there should be more screening or protocols in place for people with rheumatic conditions such as lupus or sciatica or others. But at this moment, there's no test to see. And I think that's something that's not really there, because even diabetes, you can have the HbA1c test, which tests your blood glucose levels over the 3 months and how much red blood cells you're producing. But again, there's no test to determine if anyone else in the family will get it.
Right, yeah. And did that, I know, I appreciate your sister hasn't given permission for any of this, but like, did that speed up her diagnosis once you then had that in the family from yourself?
I think she still took a similar time of diagnosis, but obviously, as I said, our treatment plans are different. But I think initially she got diagnosed with pericarditis first, and then pericarditis can be present in lupus as well later on. So obviously the diagnosis, or even if she had Sjogren's syndrome, so the dry eyes as well. So that was kind of the thing. But for my sister, she decided to live in Australia for a bit, then rushed home before the UK shut its doors in the pandemic. So obviously the journey's different. But again, I think for us, it's like, although we have lupus together, we kind of know when one sibling is like not having a great deal, vice versa. So it's kind of, we have our own inter-peer support, despite being in our own house, which is kind of nice.
Yeah, I imagine like I had to do crazy stuff like this to find peer support. So it must be nice to have access to that sort of like, especially when you're having a bad day, just want someone to understand that you're struggling a little bit. But I'm also sorry that, your family's had to have such an impact, from this. But one thing I wanted to sort of lend a bit of time to as well, because, and please correct me if I'm wrong, but like from an autoimmune point of view, lupus is one of the more impacting, I think that's fair to say, in terms of like comorbidities, the wider reach it can have. So for example, if you've got rheumatoid arthritis and you've got that damage to your joints and things like that, but with lupus, there's a lot of knock-on effects, I understand, or comorbidities, is that correct?
There is comorbidities, because obviously lupus can impact the other organs. But for me, it's only been my skin. But as someone who's an occupational therapist, I try and, for my fellow OTs, I try and OT myself through lived experience. So things that I've tried in the past. So like, for instance, I used to love swimming. Swimming was something I did quite a bit in before I went to uni and everything. I'd always swim locally. But now I know if I go in the swimming pool, my skin will not be great. So I kind of avoid that. My gym membership does cover a swimming pool, but I kind of just say to myself, it's not worth the risk to go in that, going in the swimming pool. But obviously for other things, like I do try and exercise. I think the hardest bit for me with managing my lupus was during COVID, because obviously I was told to shield. I had to stay away from my family because they all worked in the health sector, and I was still working. So I think that was something that was very interesting. So I think I did write a blog with First Arthritis about tips to manage and living with lupus whilst working from home. So I think my first tip was, I think, Joel, you mentioned about the brain fog.
I'm having a nightmare with that tonight, so apologies in advance for anyone listening to this back.
So like if you saw my work laptop, they're like, when I open up first thing, there'll be like the notes page, things to do. There'll be like post-it notes all over the screen. That's what I do. Sometimes I'll allow like a morning walk, an afternoon walk, and an evening walk, depending on the weather. But obviously the British weather has not got to the concept that it needs to be warmer, but we won't go down that point just yet. And I think it's just telling your colleagues. So like, I'm quite fortunate that I have a manager who lives with a long-term condition. She kind of gets it. So she kind of knows like, if I need like half hour extra in the day to get dressed and get to work, she kind of knows that. And I think I went through a long time when I never told my colleagues about diabetes or lupus. And I think sometimes Brene Brown talks about the power of vulnerability. And I think sometimes we have to be brave to be vulnerable, but then I think sometimes like, how can people support you if they don't know what is going on behind the scenes? So it's like, you've got that, imagine you've got that balloon, but it's not able to like pop because you're not able to share what is going on, or just telling that person that I need this. Because again, people may label you as non-compliant, not a good employee or lazy, but then again, they only know half the story to the puzzle. So I think that's kind of important. And I think just the big one that I did during COVID was to celebrate my big wins at the end of the week. Because sometimes I think we all just say, okay, we've had a week. We don't really take time to reflect, especially those who work in healthcare professionals, in healthcare jobs or other jobs. How many times, like if I asked you this week, how many times have you actually reflected on how your week has gone? You just said, okay, I've just done this, this, and this. It's like, I just need to get all this done. But how many times do you actually reflect on what happened well this week? Like the other week, I did a talk to some uni students about diabetes and AT, and I really enjoyed that. And it was nice to just spend time at the university I trained at and just reflected on my experience. But again, like the society of today is just go, go, go. But again, during COVID, we kind of appreciated the time spending indoors, but we don't really like reflect on like, this has gone well today. Okay, this didn't go so well today. Let me try this tomorrow. Or I'm going to try and go to the gym, even if it's just for half an hour and cycle for an hour or something. I don't know. But just practicing gratitude for our own well-being is important, I think, for our mental well-being.
That's a really good point, because as someone who, if I was in your position, would have spent days and weeks worrying about that talk, and then the minute the talk was over, I'd be worrying about how it went and or what's next. And you know, and I've had to do lots of CBT stuff around that. And I think, unfortunately, you having these long-term health conditions kind of lends us to be a little bit like that, because you know, you have a good day and you're, instead of enjoying the day, you're worrying about how long it's going to last or how much you've got. So for example, a good example you talked about there with work, you know, there was a day when last week I had to really take the foot off the pedal, and I had very little to show for my day, but that's what I needed to do to get through it and make sure I was in the next day. But now I'm sitting here on a Sunday evening already worried about Monday, because I feel like I've got to catch up for having to do what I needed to do. So I think it's a really good point to that practice gratitude, and it's definitely something I'm not too ashamed to admit I don't do nowhere near enough. So well done for you for sort of factoring that into your week. I feel like we should probably talk about, like, I was going to ask you, well, you know, how your condition maybe played a part in getting into the medical profession, but clearly you had lots of people in the health sector already around you. So how much was it influenced from what your family already did, and how much was it from your sort of childhood experiences?
So for me, I had occupational therapy when I was a child, and that kind of influenced my decision. When I got to writing my personal statement, my UCAS, which most people are doing if they want to go to uni, well, it's sort of completed now. I had ODP in there. I had operating department practice. I had occupational therapy, and I think I had dietetics in there. And I think it was only after taking a gap year and volunteering with the Alzheimer's Society and working at a special needs school in the area, I kind of brought back to my cause, I want to go back into OT. And then that's what I did. So obviously I had those initial discussions with my rheumatologist that I mentioned at the very beginning, that I've almost known for 10 years. And it kind of like paved the way, like, Melissa, this is, I think I was about to meet him, sorry. I think we kind of had those discussions, and obviously I chose a London uni to study occupational therapy, which was 10K for the accommodation fees. But in the end, I decided to commute from home, which is easier for me, and still have that family support. But the good thing for that is we had the discussions early on. So it kind of prepared me, like, if you're going to go and live on campus, we need to think about your prescription. Is there a GP that is close? Nearer the time, we need to think about a 3-month prescription. What do you do if you have a flare-up? Which tertiary centre are you going to? So by tertiary centre, I mean, like, who will give you your biologics? So that kind of was not settled in place. So you kind of did a referral to another London trust. And that was kind of, I say smooth sailing. Obviously, I was seen within the guidelines. Obviously, I think in the UK it's 18 weeks, but that was fine because I had biologics somewhere else. So it was kind of like the interim for the next one the following year. And I think also, how do we manage, like, if I had a flare-up? Because obviously, if I was not at home, if I was at the uni campus, how would that be managed? And then also the DSA, the Student Disability Support, and also linking up with a mental health practitioner on the uni who would give me my reasonable adjustment through occupational health. So all these things that had to be discussed. And I think sometimes just looking at one thing at a time, you don't have to do everything in one appointment. My dad was a nurse, my sister's a nurse, but now works in academia. So we've all switched, and my mum is an occupational therapist. So we have 2 OTs in the house. We would make a good MDT profession meeting.
I love that. I love the that whole picture. And I don't know about you, like, maybe it was just me because I'm old, so maybe it was different when I was younger. But when I went to university as well, it was the first time I had that experience of, like, adjustments and support. And because at high school and things like that, it was just like, if I was in a wheelchair, I couldn't go, no one could accommodate me, and you just stayed at home, sort of thing. So I don't know, it pleases me to, like, hear that you had all of those meetings and that support and the things you needed going into university. But did it feel like a step up from high school, like, experiences, or were you just fortunate?
So as I said, Joel, I still commuted in to uni, and if you ask my 12 closest uni friends, we are still friends till this day. My parents would be like, do you want me to come and get you at the train station? And they in our family group chat, it'd be like, we've gone for, like, bubble tea, or we've gone in the middle of Soho, and you're like, you come home and you've spent like £50 of your student loan or whatever. But that was us. Even now, like, if we go out of the 12 of them, one of them will always bring, like, glucose of, like, jelly babies or whatever. So it's that unique friendship. Like, it was I wouldn't say an adjustment. I think that's just friendship and just being prepared. I think sometimes in consultations, rheumatologists like your medication, your symptoms, but they don't have that, like, how are you actually doing? That question doesn't come up. The same thing as they'll just be like, are you taking your meds? And then you kind of, like, say yes, but then you don't ask like, is the meds making you sick? Are you noticing the problem? It's more just like, I want to say a tick box, but then that's probably not the right word to say. But that's what we see probably in practice because of the pressures of the NHS.
Yeah. I think as well, though, that links back perfectly to what you said earlier about, when you don't share stuff, when you don't hide stuff, people can't really help you. And I think the fact that your friends are obviously also aware, and I think that was my big mistake when I was younger. I just didn't want anyone to know. When I was sick, I couldn't hide it. But when I was well, it was kind of like, the walls went up and you try to carry on as normal. But then it did mean when you needed that support, nobody knew to offer it, and you kind of created this situation for yourself. So I think that's really special that you had that, and that's kind of what we're here for on Chronic Pain Club, that whole peer support, and people get it in different ways. So the fact that you had such a big group of friends around you that understood what was going on and could help, I think, that was really special. And I'm sure it led to better outcomes for yourself, didn't it? Like it must have done.
Yeah, I think better outcomes, but I think it's just like, like, again, like I could say to you, someone with diabetes, there's a thing in the diabetes community, like you'll know that if you hear the Dexcom alarm or if you see a test strip on the floor, you know that you're amongst the type 1 diabetic or diabetic in the room. And it's kind of like, when you go to a conference or anywhere, you see someone with rheumatic conditions, like there is someone else here. You get like very excited as if like, wow, am I going to meet this person? I think it's the same perspective, but again, it's just showing awareness of your condition and being brave and bold about it.
Yeah, that's really special, and that's why we share these stories, to try and encourage others, because I learn from my mistakes, and hopefully we can make other people think like a little bit about sharing or finding that trusted person to have a peer support network with. I think that, and it don't even need to be somebody who's living with the condition like you've demonstrated. They just need to have that understanding and care about you, don't they? And the rest will follow. So obviously you were on this path and you became an OT, and I just, before we sort of maybe talk about what you do now and how you manage now and everything, I'd just like to maybe give a little bit of time to OTs, airtime to OTs, because we've done that before on the show, and I personally feel like it's something that's not covered enough. I had to go out and find an OT who made a massive difference to me and the way I manage my condition. Do you want to maybe tell us a little bit more about the specifics with what an occupational therapist does, how it fits in, where it, and why maybe we're not quite getting that multidisciplinary kind of approach? Sorry, a lot of questions there.
So this is, I'm going to talk about OT from the UK point of view, because obviously it may be different if you're watching from America, and obviously you consult your healthcare professional first. So the role of an OT is to provide adaptation and aids to support someone to live a meaningful life. So obviously, Joel, you mentioned earlier that you had a wheelchair so you could still maintain a meaningful life. So as an occupational therapist, we might put things in place, aids and adaptation, so you can still continue to do this. So you don't need support of your loved ones or caregivers to help you. So, for instance, I think when I was diagnosed as a child, I was given adaptive cutlery, which you can find on NRIS to help, and then some therapy, because obviously to build my strength in my hands when I was seeing the occupational therapist. Transforming now, when I caught shingles, and a good OT friend kind of signposted me to the pain toolkit when I caught shingles, because obviously pain does impact our mood, our mental health. And I think it's just about managing your pain and just trying to work out, like, as yourself, what do I find easy, what do I find hard, and grade it appropriately for you. So, for instance, with the therapy, there's different strengths. So my occupational therapist at the time gave me like the lightest one first, and then the goal was to get to like the hardest one through the hand exercises. So currently, if you go to a rheumatologist, there's probably no occupational therapy in the clinic. The rheumatologist might have to refer you to one outside. But ask yourself, why do you need an OT? Because sometimes it could be the fact that you're not able to grasp or maintain object building. So like, for instance, if you've got like, if you're not able to chop your food or veg, if you're finding like using the bath hard, so maybe you might need a bath board or like some rails. It really depends. But again, it's with time, like these conditions, they do change. And I think sometimes you might find the occupational therapist sees you this year, but then after 18 months, your condition deteriorates and you need to see them again. What I will say, from someone working in primary care, there are people known as social prescribers if your GP is part of the primary care network.
Yeah.
So they can make a referral to an occupational therapist if there's grounds. But obviously each primary care network is different. So what might be advertised in Hertfordshire might be different to Norfolk or the Midlands. But it's worth asking your GP, do they belong to the primary care network? Do they have social prescribers? Do they have health and wellbeing coaches? Health and wellbeing coaches do amazing things because they will do like things relating to your health and education. So helping you with like nutritional plans, educating on you on things that you should eat, because obviously there's a lot of controversy around a like plant-based diet might help with autoimmune. Obviously that's not the time for this on the podcast, but things like that. And then also there may be some gyms that are part of the primary care network that can help you if you want to lose weight or maintain weight or build muscle strength. And then again, in that umbrella, there is the mental health practitioner. So I think, Joel, you mentioned about CBT. So sometimes I would, if I have a consultation with a patient, I might ask about their mental health, because again, you have this long-term autoimmune condition and sometimes you don't get to have that therapy to understand and accept that you've got this condition. Some days it's like, okay, I can't even get out of bed, I don't want to see anybody. And then other days you're faking it to make it so you can just pass the day. But then again, with that mental health practitioner, they can signpost you and suggest things. So in the NHS, there is something known as talking therapies. I think they offer 6 to 8 sessions, again, depending on where you live. It's free, obviously, on the NHS, but also they might be able to help you find strategies to manage your long-term condition. And I think sometimes people aren't aware of that and then want to go private, and then you could kind of wonder, what is this private therapist done? And then you're kind of like, feel like you've not wasted your money, but the money hasn't been beneficially spent, is what we're seeing. Mm-hmm. And I think sometimes it's just knowing what options are available. There's lots of things online and Twitter, Instagram. There's other things that can help signpost and resource you. But again, if I was to ask you, you probably see your rheumatologist or your clinician and get a leaflet for your medication. And then it's like, here you go, see you later, I'll see you in 6 months. And then 6 months turns into 12. Not saying I'm slating the rheumatologist or any medical profession, but that's what happens. So really do ask your GP, what mental health support is there for me? They sometimes do webinars. I attended one last week as part of training about diabetes and emotional well-being, which was great. They sometimes do one about living with pain. So do really see what is in your area, because it might just be that starting point for you to find resources of your own and make your own toolkit. In occupational therapy, we're so big on making our occupational therapy toolkit where we put things to support our patients. But what is in your toolkit as patients? Advocate your toolkit for yourself.
That is the episode right there. Like, I was smiling all the way through that comment, and I think that's exactly why it's so important to have medical professionals that are also got that lived experience and to bring you onto places like this to share that. Because, as you know, my personal experience was when I was a child, it was a rheumatologist and it was a physio, and if I went on to crutches or wheelchair, it was still the physio. And I only ever had one time when the physio ever came to our home, but it was never fit for wheelchairs. Every single room has a step in it or a level change. And I didn't go to school for months and sometimes years because there was no way that could be accommodated. And it took, I'm just about still the right side of 40. So it's still a relatively new and young issue. It took getting referred to social prescribe and in the pandemic to discover pain management, OTs, CBT and talking therapies and all this sort of stuff. And it completely changed, and I wouldn't be here doing this on a Sunday night without all of that. But it feels so wrong that somebody was living with these autoimmune conditions since I was 10 years old. It took getting to 36, 37 years old to even know this stuff existed. So thank you so much for all of what you just said, because it's really important. Because when people think, I have far too many conversations where people are like, well, the services there, people aren't using them. Well, they don't know they're available. If they don't know they're available, how can they? So thank you for highlighting that and for all of that advice about how people can go and get access to that stuff. Because it's a massive issue, especially here in the UK, isn't it, where there's all these people who can help, but sometimes they're not getting signposted in the right way. So from me and everyone listening or watching this back, thank you. So I suppose I want to just touch on a little bit, because you really are like the whole package here in terms of lived experience, OT, and I know you now work as a mental health practitioner. Is that correct? Yeah, so I'd like to talk a little bit about the mental health impact of your condition. It's something we talk about a lot on the show, and if you're comfortable, obviously, do you consider those sort of one and the same thing? And I suppose more importantly, are they treated equally with lupus, do you feel?
So I came into this mental health practitioner role about in January 2023, Joel, because it was something new challenge for me. Obviously, I'm the only occupational therapist in my team, but this kind of role kind of resonates from the NHS long-term plan. So hence I took the challenge and took the role, and I'm still loving the role. I think for me, mental health and lupus and anyone living with an arthritis condition is sometimes forgotten, because in occupational therapy, there's a lot of models we can talk about, but the one that resonates the most with this is the POP, person, environment, and occupation. So sometimes, again, when you go to the appointment, you're kind of the person, and then your environment is kind of forgotten, and then your performance, like how can you still be able to do your activities of daily living? And I think sometimes mental health can be draining, especially like for me, I've had occasions where when I've had a flare up and then obviously my steroids go up and then you kind of feel sad. Or recently we're now adjusting my steroids, which again is, for anyone listening to this, you'll be like, this is the point where you're like very apprehensive, you get very nervous, you're like, is this going to work because of the setbacks? And I think it's just trying to work out what has worked for you in the past. So like for me, my rheumatologist sent me a letter the other week, like this is your plan. But then the bit I like the most is, if you feel comfortable to try this, however, we'll go at your own pace. It was something on those lines. But for me, I kind of said to myself, okay, let's see how you treat it as one day at a time. Don't look at it like the 1st of March, you should be on this. Take it one day at a time and then ask yourself and reflect, how was today? How do you feel? Because sometimes we kind of just feel like, okay, steroids adjusting, we just want to get to that 5 or to 0 quick as possible. But sometimes slow and steady is always the best approach. And I think that's where my mental health kind of gets more deflated, when I have that flare up or the steroids haven't gone so well. Everything else is kind of fine. Obviously, you do experience the diabetes burnout, where my insulin pump will be screaming at 4 a.m. and I'm just like, can you shush? Because mummy will need to go to work, as my mom would say, as in I will need to go to work. Or there's days where I want to just throw it in the bin because it's screaming. But then I'm reminded that it's worth 5K, which coming out of my home insurance would not be great. But again, like you have these ups and downs, but then you kind of remember, like, if today didn't go so well, forget today, tomorrow's a new day. But remember that, like for me, I have a diabetes WhatsApp group. I have groups, I've done focus groups, and then people in there just send them a text, like, or like again with my family, like all I need is to send them emoji and then they're like, Melissa's had a rubbish day. Again, when I see my rheumatologist, this might sound a cliche, my mum and I will have like a briefing of things I need to talk about. Then we'll play Dalipa, don't stop now, and we'll start listening to that and just like start dancing like randomly. And then she'll always offer me, do you want me to take you? Then I'll be like, I'm okay. And then the same thing whilst I'm in the waiting room, she'll ask me like an emoji, send me how you're feeling. And then she'll start creating delete my text message. And it's quite funny, but it's what we do as a family. Like we'll start creating our favorite song, and she knows that I can just ring in the consultation. I've had patients do that and it's fine. But I think just trying to remember that it's about, although this is a bad experience now, you'll look back at it later and say, okay, I managed to get through this and build resilience. If I was to ask each and every one of you, there's probably a time where your condition's been like rubbish and everything, and you felt, I won't be able to go on this trip, I won't be able to do this. But look at where you are now and just take time to be proud of yourself. Because I think sometimes, as I said, we're just like, go, 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 go. But really take that time and just be like, okay, it was a rubbish day today. I need to have my well-being and just forget about the society, the world. There are times where I turn my phone off because my Dexcom is screaming and I will be close to throwing it in the bin. Then my mum kind of reminds me, take a breath. Let's just forget about whether you've had cake or whatever that day. I'm a big cake lover. If anyone knows about from my Twitter or Instagram, you'll know I love cake. Go have some cake. Obviously, the diabetes nurse will be like, okay, you've had cake, but that's me. And I think just remember to be kind to yourself. Again, my sister could sometimes quite stressfully, and I'm like, this is not the time. But again, it's just nice.
Yeah. And again, just brilliant words of advice. And like I say, I think if it's something that many of us do in the chronic illness community, where we kind of beat ourselves up, we're looking for the reason why there's been a blip or what you did wrong. And unfortunately, we also live in a world with social media where there's all too many people quick to tell you might have done something wrong or caused it yourself. So I think that that's really solid advice. And I also have a song that I put on when I need to kick myself out of that place. There's a song called "Drag My Body" by Hot Water Music that I always go to. I just relate to it. It's kind of like, right, nothing's going to get fixed, y'all. We need to dust yourself off and keep going. And I think, if you can find that thing that ends up being like your trigger to sort of step change, I think it's really it's really good advice. So I suppose for anyone who's listening, and thank you for sharing all of that, it's been brilliant. But if anyone's listening to this who's like maybe living with the conditions that you've talked about tonight, or has recently sort of been diagnosed with either lupus or diabetes, and is there any sort of, like, you've given loads of amazing advice tonight, was there anything you'd sort of give them specifically for managing?
I think for me, remember what I would say again, just for the last question, Joe, remember that a flare-up can happen at any time. Although at the time you may feel that you're the cause of it, you're probably not. So never feel guilty if you've had a flare-up, and just try and learn, like, okay, I've had the flare-up. Collaborative work with your rheumatologist or your doctor, whoever's looking after you, and just say, okay, maybe from this experience, I might not try and do this, or try and not take this on, or learn to say no, which again, I'm still learning to say no, but
yeah, me too.
I go to that's probably my downfall, but never feel guilty for saying that you've had a flare-up, because they can happen for all causes or reasons, and sometimes they're beyond your control. So, I forgot what your question was.
No, that's fine. No, I think it's really valid advice. So thank you for adding that on to that last point. But yeah, basically, I'd just like, as a takeaway for anyone that's maybe just hearing the end of this, joining us late, or as a bit of a takeaway for how people would, advice you would give to maybe people that are newly diagnosed with lupus or diabetes, or if you want to just pick one of those, any sort of advice you'd give them. You've covered a lot already, but maybe just as a sort of like final point.
So my top 5 would be, first, if you belong to a GP that's in the primary care network, see what they have to offer you, because again, they may call you for a health check so they can do things, but again, ask. You're there for 15 minutes. Ask, what do you have this service in place, and if not, where can I get it from? Secondly, I would say connect, be brave, be bold. Whether that's Twitter, Instagram, or any platform, find people that are advocating with the condition. So, like Diabetes UK do amazing events. I'm part of their Delia program, and First Arthritis do amazing events. The one thing I wish is my parents took me to a young residential weekend, but obviously I only found out that later. So I wouldn't say I fit the under 15 age group now. Third thing is make your own resources, make your own toolkit. I mentioned that earlier, like as occupational therapists, we build our toolkit from the flare-ups you've had in the past. What do you have in your toolkit to manage those? Obviously, I'm a regular spin goer, but what do you do to like manage your stress levels, but manage things when things don't go well and when things go great? Obviously, when things go great, you'll find me at some form of cake place. But what's in your toolkit? And the fourth thing is find someone that you can speak to that you feel content with, and also be open. As I mentioned, my mom, my sister, my dad's no longer with us, but again, he was one that I would take if we had donuts. He'd be my go-to, be my person in crime, be like, let's go. But find that family support and find those trusted friends. Obviously, there is Samaritans as well if you want to use their hotline to chat. Other mental health charities do have hotlines that you can chat to. But remember, you're not alone. There's other people living with the condition. And then my final thing is advocate for your rights. challenge and ask questions like, why are you doing this? When you see the rheumatologist, ask them for resources. And if not, tell them resources you have found, because you never know which patient it will help next. Reason I say that is a few months ago, I shared some resources with my rheumatologist, and I was telling Joe at the beginning of this podcast, the person actually, he kind of said to me, the patient that was there appreciated those resources. So you never know which person that will come next to the clinic will benefit from your resources. I know it can be a cliche, but again, as healthcare professionals in the OT community, we're very good at sharing things, but I'm yet to see that in other professions. But share something that you might feel another young person or another individual living with the condition might want to have. So those are my 5 take homes for today.
That's just amazing. I felt that you'd already given so much advice. It was a bit unfair to ask you to sort of come up with something else, and you just bang out a top 5 list, which is amazing. So thank you so much, Melissa. You're a brilliant young woman. I think for as long as we've got people like you in our health industry, we'll keep working towards those changes. Thank you for everything you're doing for people like me and those of us who are watching this live or listening to it back. And I can, I can attest to what you're doing. And I know you've asked me about resources and what could be signposted, and you're being a brilliant link between sort of the medical professionals and patients, and you having that lived experience and that professional insight is just just amazing. So thank you so much for spending some of your Sunday evening with us. Where can people find you? Because you're amazing on social media as well. So do you want to maybe give that a plug?
So I'm on Twitter mainly. Obviously, I do some advocacy work with Versus Arthritis. I'm in their young adults panel. I don't use Instagram so much, but maybe we'll see what happens in the upcoming months. Maybe I might be brave and attempt that. But you'll find me on Twitter, and I'd love to hear your thoughts on resources for young people, because maybe that's an abstract or further research at a later time. But I really hope you take one nugget from this podcast this evening.
I think there's more than one, Melissa. You've been brilliant. Thank you so much for joining us. And you're welcome back anytime. Okay. Bye-bye.
Okay.